A splint is typically used right after an injury occurs. So if you broke your wrist or your hand or your ankle or anything like that, typically you'll go into a splint. A splint, the reasoning why is because we want to make sure that that swelling can fluctuate, and we need something that can expand and contract along with that swelling. Your arm's going to change shape. You're going to get potentially get a lot of swelling. And if we were to put you into something that's hard all the way around and doesn't allow that type of movement, then you're going to get tightness. It might be too loose, might get some numbness and tingling, or stuff that we just don't want to really have you deal with. So we typically put you into a splint. It's still going to protect you. It's going to be hard on the front, what we call the volar side, and the back, the dorsal side. And it's going to have plaster, and then it's going to be overwrapped with a bunch of padding and A-strap. And the A-strap is what allows it to expand and contract. In contrast, when you are done with the splint, or if you're done with your swelling, your provider is going to kind of make that call for you and communicate with you. Upon your exam, you would go into a cast. A cast is hard circumferentially, but what we use instead of most places, we use FRC, which is called focused rigidity casting. The typical kind of cast that you may see elsewhere is fiberglass, and that is completely rigid all the way around. The FRC cast is going to be really rigid or hard in the same areas that a splint would be. So it would be hard on the volar side, the front side, and hard on the dorsal side, the back side. And then there's just a single layer of that FRC material. It's still hard, but what you're going to want to, what you can do is you'll be able to squish it. It's a little bit more breathable. So we typically use that material, and we'll show you later where with that material we can turn that into something that you can take on and off when you're further along in your recovery. And again, that's going to be between you and your provider as far as when you're going to make that decision. So what we'll do is we'll first start off with a splint. Typically with all of the directions that we give you for care, as far as something that you could take on and off, it's going to be the same exact thing. We don't want you to get it wet. We want to keep it dry just because it's something that you can't take off. So it's going to be very, very hard for the interior part of it to dry off. So I'm just going to start off with putting a bunch of padding on. Typically, we're just going to kind of get all this stuff even layered on. We're going to be very gentle, obviously paying attention to making sure that we want you to be in the most comfortable position as possible. But we're also going to keep in mind that sometimes, depending upon the pattern of your fracture, your provider might want you in a specific position, and your ortho tech will be very deliberate on that positioning and will be very communicative with where they want you. So once I have all my padding down, I'm going to move on to my plaster, and we're doing the splint right now. So the splint is where we use the plaster, and again, we're not wrapping all the way around with a plaster. Back in the old days when plaster was first created, they wrapped it circumferentially as a cast, and I kind of want to make the distinct difference between a splint and a cast, where the cast is hard all the way around, the splint is hard in just really a couple of places, and then it's covered with A-strap to help with the swelling. And the splint is used for swelling. Cast is typically used post-inflammatory phase. So your ortho tech is gonna just be measuring the plaster out, and then we'll get to kind of application once we get that measurement out. So in this bucket is just water. It's what's going to activate this plaster. We're going to dunk this plaster in, and this is kind of really the satisfying part, where your ortho tech's going to start to lather it up, and then we're going to just apply it. Now obviously Nicole is not very tender. She doesn't really have an injury, but we still want to be very careful with how we're putting it on. And your job really is just to relax, keep it in the position that your ortho tech or physician or PA or NP wants you in. And just let them know if they're causing any pain. Obviously, we want you to be as comfortable as possible and make it a very pleasant experience for you, and an experience that may not be your ideal thing that you want to go through. So now I'm just adding padding on just to cover over that ACE wrap. Now, if you are to have an operation, sometimes you do need to be in a splint after surgery, and you will be in this exact, not this exact type of splint, but a very similar type of splint after surgery. And the application process is pretty much the same. Sometimes you may just not recall us applying it in the OR, but this is kind of pretty much how it's done. And now this is called a short arm splint, and we'll be moving on to a short arm cast in a few minutes. But really, application process for any other injury, it's kind of the same thing, just a little bit of a different technique. Now here what we're doing is we're doing what we call a mold. It's an interosseous mold, so we're really just molding front and back. We're trying not to cause too much pain, so we're going to be doing it kind of a firm and gentle squish. It's not really too much, kind of like a handshake. And you're to kind of really let us know if we're causing any pain or being too rough with that. Now, some care instructions when you're done with this. The splint's not going to be fully hardened for another 24 hours is what the textbook says. It's going to be safe for you to leave by the time you head out. Your ortho tech's going to let you know it's fully dry, safe for you to leave. But if you were to rest it on a very hard surface or a point pressure surface, you could create an indentation that may be uncomfortable. So if you are in a short leg splint, we would typically recommend you to not rest your heel directly on the ground or rest your leg up on a coffee table. Just kind of keep it on a flat, soft surface. For your hand, typically on your way home, try not to rest it on the car rest. Just kind of keep it right at your stomach, a little bit above your heart to help with swelling, whatever you need. Sometimes you'll be in a sling, so you might not even have that opportunity to do so. Your ortho tech's going to be very specific in the area that they cut it off. In this instance, if you had surgery, I'm just going to stay away from wherever the wound is, and we'll read that operative note and really understand what happened during surgery and know exactly where that wound is so we can make sure to stay away from it. If you don't have a wound, your ortho tech can cut it off in either a specific place or any way that they can that's easiest for you. With this one, this splint here, we'll typically either cut it off from the thumb or from the ulnar side, your pinky side. And we're going to go layer by layer here. Your ortho tech's going to be very deliberate with how they do it, very controlled, where they're going to take this and they're just going to kind of pull things up. So your scissors, again, we're using those round tip scissors, but we're just making sure that we pull up. That way we're not really jamming our scissors right up against your skin. And right in this area here, when we're cutting up, there's not a lot of space, so it may feel like there's a lot of pressure. But again, we won't cut you. We're just going to kind of reinforce that, obviously making sure to tell you. So kind of right here where my scissors are, might be a little bit uncomfortable where those scissors are kind of jamming up on you. If it starts to feel too tight, your ortho tech's got to recognize that. And again, just switch directions and work their way down. And again, if you had surgery or if you have kind of frail skin or kind of paper thin skin, we're going to be very careful. We're going to make sure that we don't want our scissors really rubbing up against your skin. Even though they won't cut you, it may not just be the most pleasant experience. We'll then take this off, and that's where we'll be able to kind of wipe it down, wash it, get x-rays, whatever your physician, PA or NP, has for your plan during your appointment.